the value from the results from this study was that we were able to demonstrate the feasibility of implementing these geriatric standards across 8 different hospitals across the country that had variable sizes and geographic backgrounds and resources. And then from the implementation of these standards, we were able to determine what some commonly shared barriers and strategies for success were to implement these standards.
These provide evidence of real life implementation by these 8 very different hospitals, and demonstrate that hospitals can put these geriatric standards into play. They are feasible. These hospitals were able to put these standards into play over a short time period, only about 6 months, which is a pretty rapid timeline, and had high levels of both full compliance and partial compliance. And then finally, I think this effort really helped us refine our standards, identify barriers and challenges that helped us kind of put the final touches on what we now call the ACS Geriatric Surgery Verification Program, which launched in 2019. The pilot test of these standards really let us demonstrate that 8 hospitals could put these standards that we had identified into play and over a relatively short time frame. And I think that provides evidence for hospitals that are interested, for example, in improving care for older adults, that these standards are feasible and can be put into play. And we learned from this process what some of the barriers and challenges are, and we've used that information to develop some tools and resources for hospitals that are participating in the ACS Geriatric Surgery Verification Program. I should also mention that the ACS Geriatric Surgery Verification Program has a commitment level for hospitals that are just starting their journey to improve care for older adults. And the results of this pilot project really helped us identify some tools and resources for these hospitals in the commitment level, with the goal of getting them to put these standards into play, over a 1 to 2 year timeline.